Don Henley, Boys of Summer, Radio 2. Now, this next story, honestly, is going to blow your mind. What do you do if you're a surgeon who's been doing the same routine operation for over 20 years and gradually you begin to question whether the surgery is making any difference? The surgeon in question is Professor Andrew Carr. He's sitting opposite me. The operation is something called shoulder decompression surgery. So, one of Andrew's patients was 63-year-old Carol Brennan. She was experiencing the usual chronic debilitating pain in her shoulder. Pretty common this, particularly in people over their 50s. It was so bad she couldn't raise her arm. Carol was offered the routine shoulder surgery that involves removing a small area of tissue so the shoulder tendon stops rubbing on the bone. Believe it or not, 30,000 of these operations occur in the UK every year. The NHS pays about £150 million to do them. But Professor Carr said to Carol, do you want to participate in a study? And what was going to happen here was groundbreaking. Carol was going to take part in an experiment in which half the people with the shoulder pain had the normal surgery, and the other half were given what is effectively a placebo version of the surgery. So you pretend to do the surgery, but you don't. Neither group would know whether they'd had the surgery or not. So Carol had the operation, lasted 30 minutes. All the evidence suggested Carol had been in the group that underwent the routine shoulder surgery. Her arm was painful, heavily bandaged. Obviously, she'd been under anaesthetic. She had a sling. 6 months later, her condition had improved greatly. She went about her business. She went back to her yoga. And she thought to myself, what a brilliant operation that was. There's a twist to the story. Professor Andrew Carr is head of Oxford University's Nuffield Department of Orthopaedics, Rheumatology and Musculoskeletal Sciences. And you say a twist because you then ran into Carol 3 years later, right?
Absolutely, yeah.
And where was it, by the way?
It was at a village fete, actually.
Right,
yeah.
And she says, oh, you're my surgeon.
Yes.
And she says, you did a great job on my shoulder. And you said what?
She asked me if it was now possible for her to be what's called unblinded, so to know whether or not she'd had the real surgery or the surgery without the critical element, what we call the placebo surgery. And I was able to tell her, because the trial had closed and we were reporting, that she'd had the placebo surgery. I hadn't removed the spur. I'd literally gone into her shoulder, looked inside, washed it out, but had not done what we call the critical element. I hadn't removed the spur, so her spur was still there, and yet her shoulder pain had got better.
Okay, what was her reaction?
She was dumb. I think she used the word dumbfounded, and she was very surprised.
And because she would have had a suspicion that it was placebo, but then gradually her shoulder seemed to get better, and it did get better, didn't it? I mean, she then was doing her yoga and Pilates and everything else. So her shoulder did get better, but you had not done the operation. So how do we explain that?
Well, firstly, it's important to emphasise that all of the patients knew that they might either get the real operation or the operation without the critical element. So there was no deception, but they were blinded. This kind of trial is called a randomised blinded trial, where they don't know which they've had, and we watch to see whether there's a difference between the two groups. What we know from drug trials is that if you give people a sugar pill, you will, in quite a lot of people, for certain types of conditions, get an effect, but what's called the placebo effect, which is partly psychological, where you make people feel better, and by feeling better, their symptoms, particularly subjective symptoms like pain or dizziness, can be improved by placebo. And there's also a true physiological effect. We know now from brain scanning that by giving somebody a placebo, you can switch on opioid pathways in their brain that dampen down their pain without actually giving them any active pharmaceutical. What we also know is that placebo effect ramps up. A small white tablet is much less effective than a big red capsule.
Oh, really?
Yeah.
I didn't know that.
And an injection is better than a big red capsule. And more recently, what we've been learning is that surgery in certain situations may also be delivering a placebo effect.
Okay, so in the case of this shoulder surgery, just take us back here, because you were doing loads. I don't know how many you've done in your career. What were you doing when you actually did the proper surgery? What was it? What did you do?
So you put a telescope into the shoulder, you look at the space above the shoulder joint where these tendons lie, and where you see a spur present, projecting from the
Sort of
shoulder
bony
blade,
lump, yeah.
a bony lump, you remove it with a burr through a separate small incision. And that creates more room for these tendons to move. And this became incredibly popular around the world. This is one of the most popular shoulder operations being performed anywhere in the world.
Okay.
And
it's decompression surgery.
what was clear was that other similar types of operation in the knee were being proven to not be effective beyond placebo. And it was also clear to me that it didn't seem to make a difference whether I took a lot of the spur or all of the spur off. So there were warning signs that this operation may not be doing what we thought it was doing.
Were you allowed to, at one point, go into a shoulder and do nothing?
No,
You couldn't do that?
No,
Right.
What we did was take enormous care with the ethics of this, because clearly there is a difference between giving somebody a sugar pill as a placebo and giving them an operation that doesn't contain any true element of therapy. So we consulted with ethicists, we went to ethics committees, we did very wide-ranging reviews, and it was clear from consulting with ethicists and indeed with patients that what we needed to do was test this operation. We needed to do a trial like we do with drugs, where we compared the treatment with a placebo treatment.
Sure, but I just to sound like a kind of traffic warden here. Of course, the trial's not really blind, is it? Because a real placebo, the person would have no suspicion they were being given one.
Yeah, you're right.
So what you've said to Carol and others is you might have been given a placebo. So if you actually took that element away, it might be even more effective.
Exactly.
Which is incredible.
It is.
So you might never have to do another operation.
I think what's important to emphasise is that this question, this uncertainty, arises for only certain kinds of operations for certain kinds of symptoms in certain situations.
Well, let's just think here, because obviously you can't. I had a friend whose whole intestines were back to front. You wouldn't be able to do that with a placebo.
Absolutely.
Right, fine.
I know, somebody's kidney's
surgery?
not working, and you do a kidney transplant, and the patient starts to produce urine. You don't need to do this kind of trial for those kinds of problems. What we're talking about here is operations that are being done for subjective symptoms like pain, where there's no objective measure.
Would you think it might be suitable for irritable bowel syndrome?
Indeed, that's a possibility. There was a very famous trial done with tablets for irritable bowel syndrome, which showed that the drug therapy was no better than a big red capsule. It was so convincing to the patients that patients wanted to keep taking the big red capsule even when the trial had finished. So,
I'm trying to think where this could go, because the brain is in charge of so many things. If you can fool the brain, you could probably get rid of half the operations we do.
Well, I don't think half. I think it's a small number of operations, as I say, in particular circumstances. And where we shouldn't be doing them because the effect is just a placebo effect.
But where they involve pain?
Well, pain, I think, is a particular area where it is likely that placebo effects will be manifest with whatever treatment you give people, whether it's an injection or a tablet or acupuncture or surgery.
And if we go back to this shoulder condition, which is essentially it's pain in the shoulder that stops you moving it, right? And we now think it's not caused by this bony lump, a spur. Then I've got to ask, what was causing it in the first place?
We think it's probably inflammation of the tissues, and that the inflammation goes through peaks and troughs. If you have a particularly bad episode of pain, you go and see your surgeon, and the surgeon, when you've tried tablets and physio and everything that Carol had tried, the obvious thing is to think of something else to do. And if these spurs are present on the scans, then the surgeons will think, well, maybe removing the spur will help people. What we didn't do and what we should have done is properly test that surgery when we first started doing it. Yeah. And that's partly because the regulatory environment for surgery is very different to that for drugs. Drugs don't get into the market without there being proper trials, and that's not the case for surgery very often.
Let's say you meet your patient, Carol, again. And she says, "Oh, I wish you hadn't told me it was a placebo because it's acting up again now."
Yeah, well, fortunately, I have met her recently. Unfortunately, it's still not painful. So,
Okay.
But you're right. There could be, unblinding or revealing could produce an adverse effect. That doesn't seem to have happened. We have not found that with the trial
are the
patients.
operations still going on, the old-fashioned ones where they actually do things?
But it does seem as though they are reducing significantly. And indeed, NHS England, about 6-9 months after this trial, and another trial published, very similar trial from Finland, has said we really want to reduce doing these operations.
There is a real problem with rolling out placebo, that placebo is, in the end, a lie. Because it involves fooling the patient. And even your blind trial shows that to do it ethically, you've got to tell the patient.
Yes.
And you can't really say to people, we're going to give you a placebo operation on the 24th of June, can you?
No, absolutely. That is not what we should be doing. And this...
So you've got to do it while pretending to do the real operation. You have to have the whole NHS sworn to secrecy, and you do all of these operations, you cut people open, and you don't tell them.
I don't think we should be doing that. I think that's unethical.
Well, you'd save so much money, though.
Well, no, I think if the effect of the operation is simply a placebo effect, then we would... I don't think we should do that because of two things. One is risk. All operations come with risk, even if it's rare, and cost. So... we should be seeking other ways, effective treatments for these problems, rather than relying on placebo operations. The only context where I think it, is part of a trial where we're testing to see whether the operation actually works or not.
Thank you so much. Fascinating. Brilliant. Professor Andrew Carr, head of Oxford University's Nuffield Department of Orthopaedics, Rheumatology and Musculoskeletal Sciences. Amazing. Placebo operations. Speaking of which, Professor Andrew Carr was with us, who's discovered what you would not believe was possible, that if you cut somebody open and tell them that you've operated on their shoulder and you haven't, they still get better. Colin in York texts and says 2 years ago, a cardiologist in London did a trial with 200 patients who needed a heart stent due to the narrowing of coronary arteries. 100 had the stent, 100 didn't. All 200 were told they'd had it. After the operation, both groups felt they could exercise without chest pain. Placebo works. Shows the mind is in charge of so much. Maybe that's why people could walk on red-hot coals. Peter Willett in Braintree, good afternoon.
Hello.
Hi. So this is a slightly different angle here, because this one didn't go well, did it? Your doctor...
No.
Your mother-in-law's doctor was involved.
Yeah, mother-in-law doctor asked her to go on a HRT trial when she was 62.
Yeah.
She went on a trial, agreed to go on the trial. It was literally just taking a tablet once a day. The end of the first month, she started having periods again. And this went on for a couple of 3 months. And with having a sick husband, she couldn't really cope with it. So she went to a doctor and said, I need to come off it, I can't cope. They took her off it, couldn't give the results of the test until 12 months on when the test was complete. Of course, when the test was complete, she was on a placebo. She wasn't even on the drug.
So in that case, the body wasn't fooled, basically. That's what happened there.
Well, the other body was fooled because she started to have periods again at 62, which is unheard of. And she was actually on placebo. She wasn't actually on the proper medication.
Oh, I do see what you mean. The body reacted as if it was on the HRT when it wasn't, and she had. Okay, that's incredible. That's incredible. I'm now realising. All right. So she goes back to the doctor and says what's going on, and he tells her.
It's only 12 months. When the trial had finished, the trial took 12 months.
Yeah.
And they couldn't give the results, obviously, until the trial was over. But she was actually on the placebo rather than the proper HRT medication.
This is amazing, isn't it, Peter? This whole story.
Absolutely incredible. So it can work.
Yeah, power of the brain. Ashley Churchill emails, I got offered knee surgery, and just because I knew I could have the operation, I then started feeling better. And 3 years later, I still haven't actually had the operation. So I got better because they simply said you can have the operation that will cure it.